Let's head to Australia now, where Victoria has recorded its biggest one-day increase in COVID-19 deaths since the pandemic began. Premier Daniel Andrews confirmed 282 new infections overnight and 25 deaths, more than the worst daily toll of 21 reported nationally on August 12.
By way of breakdown, one male in their 60s, 4 females and 3 males in their 70s, 6 females and 4 males in their 80s, 4 females and 3 males in their 90s. 22 of those 25 fatalities are linked to aged care outbreaks. There are 657 Victorians in hospital. 44 of those are receiving intensive care and 32 of those 44 are on a ventilator.
Officials say whilst the death toll has risen, they are hopeful the lockdown is working as case numbers are falling. Almost 2 million tests have now been undertaken. Meanwhile, in New South Wales, there were 7 new infections reported overnight. 6 of those were cases of community transmission and 1 a returned traveller in hotel quarantine. It comes as families in the border towns of New South Wales and Queensland struggle to cope travelling between states to work and school. The ABC's Gemma Sapwell reports.
It's breakfast time in the Sayer household as the family of 5 get ready for a busy day. They live in northern New South Wales but work and go to school in Queensland and cross the border multiple times a day.
We're having to get up extra early, like at least an hour earlier than we normally would, so it's hard on the girls. It's long days.
Delays at border checkpoints and changing permit requirements make everyday life a challenge.
Yesterday the M1 was 45 minutes, but I've come Duckett Street today and we seem to be flowing a lot better.
Elizabeth Sayer says at the height of the border traffic chaos, her 6-year-old daughter suffered a serious medical episode at school.
I was stuck in traffic. The signs were saying minimum 2 hours to cross the border.
The mother of 3 describes it as the worst day of her life.
And I couldn't get to her and be with her. It was horrible.
The stress of the past 5 months has taken its toll on the family's mental health.
What I'm seeing in my rooms, lots of border community people, is grief and loss and trauma.
Schools along the border are also having to adapt, with buses running up to 2 hours late.
Our school is located directly on the border of Queensland and New South Wales. In fact, our back fence is the border. To combat some of the problems, we've staggered the end of our school day.
The only people currently allowed to enter Queensland by road are truck drivers, workers who transport freight, people performing essential activities and border zone residents. With the Queensland government flagging even tougher restrictions if New South Wales coronavirus cases move closer to Queensland, the Sayer family is now looking at moving north over the border.
A lot of the girls I work with, they're in Queensland. They've offered their house to us to move in with them, which is lovely, but we are a family of 5, so that's a last resort.
And that was the ABC's Gemma Sapwell reporting.